Perfect timing for my shirt. Good evening, everyone. That's the beauty of live Facebook. This is Dr. Sullivan. I am very happy to be with you for another I Care for Your Brain lecture. Tonight was actually inspired by a nice gentleman who Facebook messaged me asking about the connection, if there was one, between traumatic brain injury and dementia. And that's what we're going to talk about tonight. So if you are out there and you have a specific question or a topic that you would like me to talk about, it would be my pleasure. You just have to send us a message and I'll do my best. This is I Care for Your Brain with Dr. Sullivan. That is me. I am a clinical neuropsychologist practicing in North Carolina, and I am here to give you science-based brain health. I want you to have a reliable, objective source to get brain health information from that is not coming to you from a commercial or a magazine article or a magazine article masquerading as a commercial or vice versa. I do weekly brain health lectures here on this Facebook page, and people out there seem to be liking it, so that is a great joy to me. We are talking about this connection between traumatic brain injury, which people often call TBI, and dementia. But before we really get to the meat of that topic, of course, we have to lay the groundwork for understanding what really is TBI and what really is dementia. So with TBI, a great place to start is for us to talk about severity, okay, because there's a wide range. You might be surprised to know that a one-time concussion, which can also be called a mild traumatic brain injury, those are interchangeable terms, really is not that damaging to the brain in the long term based on many good quality scientific studies. If there's no positive findings on brain imaging, meaning there's been no fracture, there's been no bleed, and the loss or alteration of consciousness, meaning someone actually blacked out, they actually lost consciousness, or an alteration of consciousness is kind of seeing stars, kind of like what you see in the cartoons, the birds going around the head, just feeling disoriented, kind of out of sorts. If that was brief, okay, within a very short amount of time, a few weeks, 3 months at most, the vast majority of people make a full recovery, okay? If symptoms persist beyond that, in my experience and in the writings of people who are really experts in this, there's typically other factors that are perpetuating the concussive experience. Most commonly, this is pain. A lot of times when people get hit in the head, they have some type of a neck injury that perhaps isn't identified if it wasn't so severe as to be a fracture, right? We also get things like new medications that people maybe started to take for some pain. That can have an effect on your cognition and your mood. Also, a lot of times things that are traumatic to us physically, like a blow to the head, are also traumatic to us emotionally, psychologically, and this pairing between different types of trauma can have a very big impact on brain functioning, not necessarily from a neurological standpoint, but just more of a reaction and a coping kind of a standpoint. On the other end of the spectrum, of course, we have severe catastrophic brain injuries that either result in death, coma, vegetative states, all the way through really disabling people. They can no longer work, they can no longer really function well in relationships, they have a lot of cognitive symptoms, a lot of mood symptoms, a lot of sensory symptoms, changes in their vision and in their hearing. So typically the way we break down TBI is by severity of mild, moderate, or severe. There are a few different scales that doctors, scientists use to judge which one of these a person meets criteria for, but typically what you want to look for and what is the best gauge into how badly the brain was hurt was that level of a loss or alteration of consciousness right when the accident happened. So typically when we think about a mild traumatic brain injury, it is a loss of consciousness from 0 to 30 minutes. And I think that's pretty important to know because before I learned about all this stuff, 30 minutes of being unconscious from a blow to the head, oh my gosh, that sounds very severe. But really, you have to go between 30 minutes all the way up to 24 hours of unconsciousness to be in the moderate stage And if you are unconscious for more than 24 hours, that's when you get into the severe stage. Okay, so that's the absolutely blacked out, lost consciousness. In that alteration of consciousness, so the confusion, disorientation, for mild TBI, that can just be a moment all the way up to a full 24 hours. If you get beyond 24 hours, you're either in the moderate or the severe range, and that depends on the different criteria that you're using. We also have something called post-traumatic amnesia that we use to judge TBIs. And what this means, there's really two different kinds. One is retrograde amnesia, meaning a loss of the memories before the accident, right? So as a neuropsychologist, one thing I typically ask people is, what was your last memory before the accident or the event? And what was your next memory, right? So say the event happened on Saturday at 12. If the person can remember all the way up to 11:45, driving to the supermarket, and they just lost a few minutes before the blow to the head, that is a much better predictor of a good prognosis than if somebody lost 2 hours, or if they don't remember getting out of bed that morning, or sometimes people don't even remember a few weeks before the blow to the head. We also have anterior grade amnesia, which is going forward. This is the ability to make new memories following a blow to the head. So both of these are indicators of how badly the brain was injured. Typically, the ability to remember things that happened before is more related to injury in the frontal lobes, and the ability to make new memories following an event is typically related more to the temporal lobe. We also go by something called the Glasgow Coma Scale, and this is the most common scoring method for describing a level of consciousness. Okay, so you can either get a score of 0, which is you're doing very, very badly, all the way up to 15, which means you're fully conscious, your eye movements are great, you're oriented, you're able to interact with people in an appropriate way. The most common events that result in TBI really depends on your age. So a lot of times in adults we have falls, motor vehicle accidents, unfortunately violence, younger children, teenagers, we have sports injuries, and of course in our veterans we have explosions, combat related injuries. Those are probably the blast related injuries of our veterans. That's probably the getting the most amount of money right now for research funding, and also the most poorly understood. We know that the way blast injuries affect the brain is by the pressure wave that just passes through the brain, and really it affects all of the air-filled pockets in the body. So this is why typically somebody who's been involved with a blast or an IED talk about the air getting sucked out of their lungs, or their eardrums rupture because of the air that's contained in that pressure system. So of course we have the brain, we have the covering of the brain, and we have a little bit of space that lives between the brain and the skull, and typically that's where we get kind of a shearing of the fibers that cover the brain, is because this pressure wave just kind of blasts throughout the entire body. You also can have a penetrating brain injury where something actually goes into your head. This is like a bullet or an arrow, any kind of a debris or shrapnel that moves throughout the environment. So there's different ages that people are more likely to get a TBI at. Newborns to 4-year-olds, there's a peak there, and a lot of that is falling out of bed. In young adults, 15 to 24, typically the sports injuries. If someone has attention deficit hyperactivity disorder due to the impulsivity, not having a good grasp on consequences, that can make you more likely to do risky things that result in a TBI. And once you're over the age of 60, it's definitely related to falls. So according to the Center for Disease Control and Prevention, Americans over the age of 55 most typically go to the emergency room with a fall-related TBI. And in general, all of the hospitalizations in this age group are related to blows to the head. So that's pretty significant. What we think, though, is that this is actually an underestimate, because many people don't go to the emergency room unless someone brings them after a TBI, or unless they're really injured, in part because if you're having one of those alterations in your thinking, you're not exactly thinking straight, are you? You might even be confused about what happened. Many people, in my experience, have, say, a car accident, they're not really operating on a full deck, and they ask them, would you like to go to the hospital? The people deny it. They're shaken up. They just feel like, I want to get home. They get home, and a few hours later, oh my God, they feel like they've been hit by a bus, or they go to their primary care doctor the next day, and they're the one that send them over to the hospital. So there's kind of, for some people, a little bit of a delay in seeking care. Males in any age group have an increased risk, and of course substance abuse. If you are impaired, chances are you're going to do more risky things too. Now, of course, TBI has both acute, meaning immediate, and long-term effects, right? It goes through every system. There are physical symptoms, there are sensory symptoms, like I said before, visual field cuts, sensitivity to sound, cognitive symptoms, mood and behavior change, personality change. Mild TBI, of course, has the smallest amount of side effects and long-term impact. But one thing we're not really sure about right now is the impact of multiple mild traumatic brain injuries. That's where these NFL concussion examinations come in, and we're trying to figure out what happens between our professional sports players or our veterans who are exposed to multiple TBIs, even though they're mild, within a very short amount of time. All blows to the head, if they involve a loss or alteration of consciousness, involve multiple chemical and molecular changes that happen in the brain. Okay, so we're gonna now kind of take a little step back in history and think about, when did we start to make this connection between TBI and dementia? Well, it all started with boxers. Have you ever heard of that term, punch drunk? This goes all the way back to 1928, and there was a Dr. Martland, and basically he started to notice that men who were involved with contact sports with repeated loss of consciousness events were having cognitive problems and trouble with tremor after they retired, so years and years away from when they actually had they were involved with sports. And what he was able to conclude is, from looking at their brains, that they had a lot of micro bleeds, a lot of micro hemorrhages that were later replaced with something called gliosis. And that's a very complicated chemical brain thing. But the way I want you to think about it is, it's basically an immune response that results, the end result is like a scar. And if you get enough of these scars, you actually get death of brain tissue in a specific area. And kind of think of this like a little lesion, and this goes by the name encephalomalacia. So if you've had a really bad TBI and somebody gives you a CT scan or an MRI scan, they might say in the report, or the doctor might tell you, there was an area of encephalomalacia. And what that means is there's a scar tissue and an area where there's not good, healthy, robust brain tissue. So there's really two ways that dementia can come into this conversation. One is, if someone's TBI is bad enough, let's just say there was some kind of a bleed, they had to get a brain surgery like a craniotomy, they can be left with vascular dementia, unspecified dementia, immediately following the injury. And for some people, it can improve. For other people, it's just the way that they are. That's the whole world of brain recovery and plasticity, which we have some lectures on that if you want to look at those when we're done. But what we're really talking about tonight is the prolonged, years down the road effect, right? And there has been a lot of controversy about this because the studies were not very well designed. Part of the big problem was that we have this spectrum of severity within TBI. So they were mixing up the mild with the severe, and they weren't really parsing them apart. The other problem is they were asking people to rely on their recollection about their TBI. And guess what? Our memory, our autobiographical memory, kind of stinks. We're not that great at being able to tell someone how long we were unconscious for, right? Makes sense. We also had people who were very confused about how long they were unconscious for, combined with that alteration of consciousness. So if you're just going by a human being's report, you're not going to get really great data. It's going to be kind of muddy, right? So in these studies, though, they were starting to find a trend that in general, there is an increased risk of getting all kinds of dementia when you have a TBI history. So there's two things that we need to talk about as it relates to that, is the age you were when you got your TBI and how bad your TBI was. So to make that point, I want to share two studies with you. The first one came out in 2014 called Dementia Risk After Traumatic Brain Injury versus Non-Brain Trauma, the Role of Age and Severity. And this was published in the Journal for American Medical Association Neurology by a Dr. Gardner. She's the main author, and it's from the Memory and Aging Center at the University of California in San Francisco. And what she found is that when you had a TBI history, your risk increased about 2.5%. Okay, so people with no TBI history have about a 5.9% risk of developing dementia, but when you had a TBI of any kind, it went up to 8.4%. Now, honestly, that's not huge numbers, and it doesn't really, you might have listened to this lecture tonight because you have a TBI history, because you know someone that does. We're not saying that the risk goes from 6% to 50%, okay? We're talking about a few percentage points up. So I want you to listen. I want you to listen to my take-home messages, but don't necessarily be filled with anxiety because I'm talking to you about this link, okay? But what they found was that people who had the moderate or the more severe TBI from the age of 55 on had an even higher risk, or if you had even a mild TBI once you were over the age of 65. So this is where the severity age interplay comes from, okay? So one of their hypotheses was that the younger you are when you have your TBI, the more resilient your brain is to being able to recover. And I think this is a very important point. The overall health of your brain when you come into any type of brain injury, brain disease, brain disorder, whether that's Parkinson's, a TBI, multiple sclerosis, anything at all, really impacts the outcome. And there's two reasons that this is probably true. It comes down to compensation, the ability to compensate on the molecular level and the ability to successfully engage in workarounds for your problem, finding a different way to do something, okay? So it's just like any other part of the body. If you have an older arthritic wrist and you've broken that wrist twice, if you have a fall and you land on that wrist is not going to recover like it would if you were 30 and you had never broken your wrist and it had no arthritis, okay? So this is why it's critical that everyone cares about brain health. It's not just something you should care about once you have an injury. Unfortunately, that's kind of the way we're going right now, is that people only seem to care once it affects them. But the truth is, we all have a brain. We all have bad luck. We can all have something happen to us. So we need to do things to constantly be working on the health of our brain. So that second study was in 2018, very recently. And what was so cool about this one is it was what they call a population-based study. So this is like taking all the people in a country. In this case, it was Denmark. This was a study that was published in the journal called Lancet Psychiatry. And this was really one of the first ones to have a good enough size. What they did is they used the documentation from emergency rooms and inpatient hospital stays to have objective data about the TBI. The closer in time to the event that caused the TBI that you ask someone how long do they think they were unconscious for, or you have medical personnel chiming in about how long they observed confusion for, that's the best data that we have to really judge the severity of a TBI. So what they did is they looked at these registries, these databases, over 36 years for all the people living in Denmark from 1977 to 2013. And what they found is that people who had at least one traumatic brain injury were 24% more likely to be diagnosed with dementia than those without a history of TBI, and they were 16% more likely to be diagnosed with Alzheimer's specifically. So the way they help us understand this is by talking about what your risk is, right? So their risk, they said, rises from 1.22 to 2.83 once you have 5 or more mild traumatic brain injuries, or when you have a moderate or a severe traumatic brain injury. So again, we're seeing this interplay between severity and long-term outcomes. So one thing I'm going to advise you on when we get to the end of my talk, and this goes along with all my one of our themes, is you need to understand your brain. What was the severity of your brain injury? And I'm going to tell you how to do that. So the next logical question is like, what's the bridge? What's the connection? What's the mechanism? What is it about the TBI that maybe goes on to result in increasing your risk for dementia down the road? Well, there's really three main theories that are out there now. The first one is that something happens that triggers some kind of a neurodegenerative chemical snowball, okay? Number two is that maybe there was something already happening in terms of dementia, and the TBI basically puts it on fast forward, right? It throws on the gas pedal, and we get an acceleration of the disease, we get an acceleration of the symptoms. The third one is that it reduces the ability of the brain to compensate. It reduces the contents of our cognitive reserve, which we've talked about before. This is basically the brain bank that you have that gets filled up by your education, the complexity of your job, the hobbies that you do, your intelligence, the quality of your social life, the quality of what you eat. It's like your little brain checking account. And the idea is there's something about TBI that makes the brain have to work harder, so that over time it's chipping away at this balance, this nice surplus that you have in your brain bank, especially when you get some normal brain aging on top of it. Okay, so I want to talk to you about that in more detail. So what a lot of scientists think is even deeper within those three possibilities is that what's most likely happening is a disruption in brain flow, okay? And so we now talk a lot about neurovascular disease when we start to talk about the link between TBI and dementia. And the most work on this has been done in Alzheimer's disease. And what they're talking about is these plaques and tangles that are the cause of Alzheimer's disease, these amyloid plaques and tau tangles. If you were with us last time, we talked about Alzheimer's, so if you want to learn more there. But this line of research really got kicked off because of some autopsy studies where they looked at relatively young TBI folks who had died, unfortunately, due to in the acute phase of their recovery, so within a few weeks. And what they found is they had very similar amyloid plaques in their brain, just like folks with Alzheimer's disease, and they were all throughout the brain, in the gray matter and in the white matter. So this got us to start thinking, what exactly is happening in the brain? Why is it causing these plaques and tangles to build up? Well, what they really think is it comes down to this blood flow, and it can either be too little blood flow or too much blood in the brain. So let me tell you what I mean by that. So too little blood in the brain is called hypoperfusion. And this can happen due to all sorts of reasons. It's basically not getting enough oxygen to the brain. And so this can happen because there is the shearing of the brain cells, that the white matter, there's white matter that connects different parts of the brain. And a lot of times if you have a very quick mechanical injury, the brain jostles around a little bit in the skull, and you get a lot of ripping on the outside of the brain. There's a little bit more room in the frontal part of our the space between the brain and the skull. And the skull on the inside is actually very, very rough. The first time I touched a skull on the inside, I was absolutely shocked, because if you think of a skull, you see pictures of skulls, it looks relatively smooth, right? It's kind of shiny and white. Well, I turned it over, and if you look inside, the eye sockets and all of the things that help keep our facial structures in place are actually very, very rough. They are pointy, they are little jabbers, and when you get soft brain tissue up against that part of the skull, you get a lot of shearing. Anytime someone gets hit in the brain, there are two areas of injury. So it's where you actually got hit, but then that's called the coup. But you also get the counter coup, which is that brain unfortunately slams up against the other side of the skull. So typically if someone has a little bit of a bruising in the brain from a TBI, you usually have 2 points of injury. Most commonly, it's in the front and the back, just because, remember I said the front, the brain has a little bit more room to move. So that can cause things like swelling, inflammation, and that reduces the overall oxygen to the brain. Okay, so that's no good, right? The oxygen brings the blood brings the oxygen, it brings the glucose, it's where the immune system really gets to help the brain. So that's considered a risk factor. There's also been some interesting studies showing that people who have sleep apnea, which results also in poor oxygen at different points in the night in the brain, that they also typically have more plaques and tangles in their brain. So one thought is, there's the TBI here and dementia here. Is there a direct link, or is there something that is connecting these two, like let's say sleep disruption, for example? And what's related to that? This talk's kind of complicated tonight. I hope I'm making sense and making this helpful for you all. But the mechanism underneath poor oxygen is impaired clearing. So in all brains, as we get older, we are all making these plaques and tangles of Alzheimer's disease. But in a healthy brain, we have a very complex system where our immune system and our brain work together to basically chop up those plaques and tangles and clear them out. They're like the garbage men that come in, they put them in their receptacles and they get them out and they get excreted. What Alzheimer's we think is that clearing system is somehow not working, and the plaques and tangles build and they spread throughout the brain. Okay, so when you have something like a brain bleed, so this is where I'm talking about too much blood in the brain could be the problem. The brain does not like that. The blood and the blood that should not be there in the brain are not friends. It's like oil and vinegar. When there is blood in the brain, it's very irritating to underlying brain tissue. This is where a lot of people can get seizures from after a brain injury. And the immune system wants to do everything it can to get that blood out of there. So the idea is that the immune system only has so much focus, it only has so much energy, and it really works its best when we're in a very deep sleep. So again, we have a sleep TBI overall brain health connection. So if we're not getting good sleep, if our immune system, when it is working, is very, very focused on getting the blood out, the idea is maybe is it turning its back on clearing out those plaques and tangles, okay? If you heard a few months ago in the news, there was talk about diabetes 3 and how did this relate to Alzheimer's? It's the exact same concept. It's that if there's too much sugar, too much glucose in the brain doesn't want that. It wants to clear it out. Well, if it's busy clearing that out, it's not able to do two jobs at once. So it again turns its back on this normal Alzheimer's pathology that in a healthy brain can clear it out, but it can't do the job. So it kind of builds up behind its back. Okay, so when we think about inflammation in the brain after a TBI, we know for a fact that in the first 1 to 7 days after an injury, it's absolutely there. But there's also been really good studies with sophisticated neuroimaging like PET scans that show, and there was a couple studies, even 17 to 20 years after a TBI, there were patients that still had abnormal chronic inflammation in the brain. So there's something that's happening in the vasculature of the brain, the ability of the brain to get blood, the ability of the blood to really use its oxygen to the best of the brain's ability. And when other things are happening that are a part of normal aging, this is when we really seem to see the problem where it blossoms into dementia. So this is why if you've had a TBI, you have to be really good about monitoring your overall health. The things that are most influential are things that are related to blood flow. High blood pressure is the biggest herder of the brain as we get older. High cholesterol, it's a little bit more controversial, but again, the idea is if there's too much of something in the brain that shouldn't be there, it gets distracted and it can't clear out the remnants of the brain injury, it can't clear out the Alzheimer's pathology that's building up normally, that would normally be cleared away. Things like diabetes, you don't want too much blood sugar in your brain, it's very unhealthy. You don't want too little blood sugar in your brain, right? Poor sleep, time and time again, the quality of our sleep is proven to be related to our brain health. That's part of the reason we think neurofatigue is a phenomenon. Why do people get so bone-crushingly tired after a TBI? Probably it's our immune system in part that wants to put us to sleep so it can do the really hard work of clearing things out. We also know things are much harder when you're compensating and doing all those workarounds, so you're getting some mental fatigue too. So I really care about how does all this research, how does this knowledge impact your personal care, right? So my take-home messages are you need to understand what was the severity of your TBI. So you can go back and listen to my talk and, how did I break it down? You can also just Google TBI severity scale. There are some differences, but they're all generally about the same. I like the one that the VA uses, the Department of Defense uses. You have to think about how many TBIs have there been. The more you have, the worse it seems to be. The worse you had it, the more risk you have in the future. But of course, what you need to do is to try to reduce your risk of any more TBIs. I assume most of you out there are adults or older adults. And if you look at the data, the number one thing that can get us is falls. So I want you to really think about fall prevention, okay? So this is something as easy as really using your seatbelt every time you get in the car, getting good enough exercise where you actually have good core strength and you can manage a little bit of dizziness and imbalance that comes along with aging. Make sure you keep clutter out of the way. The lighting in your house is good, especially going from the bedroom to the bathroom in the middle of the night. The bathroom is the number one place for falls, so even if it's overkill, handrails, non-slip mats in the bathtub, making sure that you're drying yourself off in the shower before you get out. Wearing helmets when you do things like bicycling, right? Making sure that you're not doing silly things like having a couple glasses of wine and going up on the roof to get the leaves out of the gutter. That is actually taken from real life. I had that situation recently in my practice. You also just need to be aware of brain health, and this is probably why you're with me today. You have to do all of the things science tells you to influence the health of your brain, and this gets back to that inflammation, making sure you eat a brain healthy diet. Exercise as medicine. Really change the way you think about exercise. It's not just to look good, right? It's really not even just for your heart. It's to make sure that the blood flow is as good as it can be to this brain. And I think prioritizing sleep is absolutely critical. You don't want to sleep too much, but you really don't want to sleep too little either. People vary in their needs for sleep, but about 8 to 9 hours is thought to be what we need as human beings for a healthy immune system and for the very best cognition and the best mood that we can get. But what you need to make sure is that you're actually going in and out of all of the phases of sleep. There's different things our immune system does at different phases of sleep. So continuous sleep is the best advice I can give you. If someone tells you you snore, if you get up a lot to go to the bathroom, these are things I want you to talk to your doctor about. It's not just about not feeling great the next day. It's literally not giving your immune system enough prime time in your brain. And when you've had a TBI, all of these things are even that much more important. We are going to be back together next week. I'm going to talk about reversible causes of dementia. These are things that walk and talk like dementia, but if you know about them and you treat them, you can actually turn back the hands of time and reverse some of that cognitive impairment. If you thought that this talk was helpful, interesting, I know it's a little bit of an anxiety-provoking topic, but I actually feel like knowledge is power and it's reassuring. I would appreciate you sharing this. The more people that know what we're trying to do here at I Care for Your Brain, the better I feel about putting my time and energy into these lectures. I hope you feel that I have done a respectful job of your time and your attention. And the more people that know about it, the better, because we want to be the loudest voice in this brain health arena, right? We don't want people selling products and corporations selling too good to be true brain health scams to have the loudest voice, right? So the more we can get the scientists and the doctors out there talking directly to people, I think it's going to be a better brain health world. So thank you guys so much, and I'll see you next Wednesday. Bye-bye.